We go now to business. The developing 8 countries, also known as the D8 Organizations for Economic Cooperation, says it will work towards increasing trade between member states from $100 billion currently to about $450 billion in the next 5 years. Minister of State for Foreign Affairs, Ambassador Zubairu Dada, who was at a lunch which saw the attendance of all the ambassadors of all D8 member states, including Bangladesh, Egypt, Iran, Indonesia, Malaysia, Pakistan, and Turkey, says that the new secretariat will now equip member states to be able to work towards achieving Sustainable Development Goals 1, 2, and 3.
The outbreak of COVID-19 pandemic is a stark reminder of the need for nations to build and maintain sustainable health systems. It is as well a call for us to commit to the realization of health-related sustainable development goals. I am therefore delighted that the D8 established this office to respond more quickly and effectively to health and social emergencies as the one currently ravaging the world. The commissioning of this office this morning would help drive our shared aspirations towards achieving affordable healthcare costs, inclusive social protection program, and reformation of our healthcare system.
The commissioning of this office is very important that we take a fresh look on the health issues because we are fighting together.
We want to support our member countries in terms of health rates. We want to encourage and boost health rate within the member states. The 8 countries has a combined of $4.5 trillion, 1.1 billion people, but the trade between the member countries just translates to about $100 billion, which is grossly inadequate. So we want to ensure that we boost that trade within member countries to the tune of about 10% annually for the next 5 years, so that we can be able to get a huge chunk from the $4.5 trillion economy to boost the economy and then create jobs and then create employment within member states, and then also be able to boost the economy of our member states.
Joining us now to speak further on this is Dr. Ado Mohammed, the Global Program Director, D8 Health and Social Protection Program. Many thanks for joining us. The Minister of State just talked about a more effective response for health and looking health emergencies, especially in light of the COVID-19 pandemic. How do you think the new Health and Social Protection Program Secretariat can make this happen?
Thank you very much, and good afternoon, Nigerians. For us and D8, it's all about health and social protection. So when the COVID-19 pandemic came up, we, working with member states, convened a meeting of all the 8 countries. And what really I felt is that it's important that at this particular point in time, there's need for cooperation, there's need for collaboration, there's need for partnership, and there is also need to share knowledge and best practices. So that meeting, which we had in April this year, is to agree on the way to go. We all know that countries were all stretched at the peak of the COVID-19, and each country needs support. So we came as a bloc and agreed that there is need for us to work together to address the pandemic, to tackle the pandemic, and to see how we can minimize the impact on the health system and our economy. So what we actually did was to constitute 2 working groups. We had the working group on resource mobilization. We also had the working group on implementation monitoring. Resource mobilization is important because we know that at the peak of the crisis, quite a lot of countries were in need of even having some things like equipment like ventilators, masks, some consumables, and then some other items that to address and tackle the pandemic. While some countries had excesses, some do not have some of these items. And through that platform of resource mobilization, we're able to support each other. For example, some of the ventilators that came into Nigeria at the initial stage of the pandemic came from a member country, which is Turkey. So we brought in some ventilators from Turkey, and some consumables also came in from Malaysia, some from Bangladesh. So you can see the benefit of that meeting. Secondly, we also felt that yes, resources due to the health system could be compromised and limited because most of the countries had some challenges, in terms of their finances. So we work on the resource mobilization to complement each other. Then in terms of tracking, we also said, look, there is need to have implementation monitoring so that we can track all the agreement and resolution that are reached. And so far, so good. We've been able to put in place a monitoring mechanism to ensure that all the agreement consensus that were reached, within the countries, that were agreed by the countries, were implemented. Right. So that is where we've, so far, we've tackled the early stage of the pandemic. But post-pandemic, we believe that the way to go is universal health coverage. We have to have a resilient health system in place to address the pandemic in case of future emergencies. And we agree that we need to boost our surveillance system. And so we are working on a protocol to have a joint effective surveillance system so that in the future, if there is any other pandemic emergency that comes up, we're able to tackle it.
All right.
So we are working on a
do you also, okay, away from health now, do you see more effective collaboration among the D8 member states, not just in health, but maybe social protection initiatives?
Thank you very much for that question. Let's not forget the fact that health goes beyond absence of disease. Health is about overall well-being. And when you look at health, there's link between poverty, ill health, and disease. So for us, we are looking at health holistically, just going beyond. We're not looking at health in terms of just absence of disease. We're looking at it in terms of complete overall well-being. Now, if you're looking at health in terms of well-being, then you also have to look at poverty, you also have to look at disease, and then you also have to look at hunger. So there is link between poverty, hunger, and disease. So, and when you talk of, if you are going to prevent disease, you also have to eliminate poverty. Now, if you are eliminating poverty, that is where social protection comes into being. And that is why for us, we have a unique program that is about health and social protection. Unlike other programs that just speak to health specifically, where it's about health and social protection. Now, what are we doing to tackle that? We are working with member countries to see how we can address the issue of poverty. Now, for example, if you look at poverty, even out-of-pocket expenditure itself is huge. So what are we doing? We are working with member countries to mobilize resources so that we can address the demand side of healthcare intervention, which is preventing people from huge out-of-pocket expenditure through universal health coverage. So working with, for example, National Health Insurance Scheme, we are working towards reducing the huge 70%, over 70% out-of-pocket expenditure. So that is the entry point when it comes to social protection and health. But beyond that, similarly, we have SMEs. So we are working on doing out a kind of mapping now on SMEs.
In the interest of time, Doctor, in the interest of time, we do get the picture that something definitely is happening with the D8 as regards social protection initiative. You talked about growing trade among the D8 member states by 10% for the next 5 years. Is this plan not too ambitious? We're talking about $450 billion.
If you look at it, we have a combined economy of about $4.5 trillion. And the trade between member countries is just about $100 billion annually. That is grossly inadequate. Now, for an economy of $4.5 trillion, if you are trading just about $100 billion, that is not acceptable. So what we are trying to do, and that includes health and other sectors. So what we are doing now for health sector is we want to see how we can boost the trading between member countries to the tune of about 10% annually. Now, when you look at 10%, we're talking of annually about $11–12 billion increment annually for the next 5 years. And we believe that this is doable because as it is now, we are discussing and working with Islamic Development Bank. We are working on revitalizing the health markets across the health value chain within the 8 countries. We are going to build capacity of member states. We are going to identify what are those regulatory challenges that mitigate against trade between those countries. And then we are also going to see how we can work with member countries, in terms of enhancing and then encouraging trade within the member countries.
There are those who say, there are those who say, sir, that the cooperation by member state has not really met their expectations. What should Nigerians expect from this collaboration, this kind of economic union, so to speak?
I think we've made a lot of progress in the last 22 years that D8 has been in existence. But recognizing the fact that you cannot talk of economic prosperity without human capital, which is health and education, then it's important that I'm happy that we are coming on board as a health and social protection program. And I'm also happy that the government of Nigeria have requested and is hosting this secretariat. So for Nigeria, what will be happening in the next 4 to 5 years is we are going to support Nigeria in terms of fast-tracking SDGs 1, 2, and 3. That speaks of poverty, that speaks of hunger, and then speaks of overall well-being. Now, how do we do that? In specific times, we are going to...
All right, Dr. Ado Mohammed, I want to say thank you very much. I'm afraid that's the much time will permit us. Thank you very much for joining us on the news and talking to us about the plans of the D8.
Thank you very much.
Up next is our roundup on entertainment.